if you have experienced a knee injury, you probably have experienced loss of your quadriceps muscle or muscle atrophy of that muscle. This is the most commonly atrophied muscle after an injury or a surgery to the knee. And I want to talk about why that happens, how we address it, and how we get your quad back to where it should be prior to what it was even before your injury. We want to get your quad firing the way that it should be, and being equal to the other side is the ultimate goal. But let me just show you some pictures here that might resonate with you. So we have, let's see, a picture here of someone with severe muscle atrophy of their quad. You can see the definition of the muscle here, the muscle, the growth here, like how big it is compared to that guy, right? And this can happen in an instant. Typically, muscle atrophy happens at its max about 2 weeks after an injury or surgery. So it's crucial that you get back into doing exercises for your quad immediately after an injury or a surgery. This is another example. He's probably right after surgery because he still has the marks on his legs. Did not operate on this side. But you can see how much bigger this side is and well defined. And he probably didn't have surgery that long ago. Now maybe he had an injury and he had to wait weeks or months to be able to get that surgery. But look at how much muscle loss there is. And he's probably actively contracting that muscle and it still looks that small. So again, these things happen so fast. It's unfortunate, but it takes so long to gain muscle, and you can lose it in literally days, which is so frustrating. I always tell patients, I'm like, that is the most frustrating part of this, is that you literally can lose all the muscle that you've been working really hard on for months and months and lose it in a couple days. And now this is typically heightened if you're not putting any weight on the leg. So if you're non-weight bearing, it's going to be very hard for you to be able to maintain your muscle. Now there's a lot of ways around it though, and we will be doing some of those in this program. But if you are not contracting your quad properly while you're walking or squatting or just doing daily activities, that's going to really affect, the atrophy of your muscle. So let's go over the why this happens, because I think it's important. A lot of times, we don't even know why. Why does this happen? I'm going to share my screen here. So, forgot to put myself in the corner. Hold on. All right. There we go. Okay. So, why does this happen? Now, I just realized I'm like covering some of that. Sorry, guys. I don't want to cover up. I want to make sure that you can see everything here. Maybe I got to make myself a little bit smaller. All right. Hopefully you can see everything now. Yeah, there we go. Okay. So this is just an example, but we have an ACL injury. This could be any knee injury. What happens right away is that you get pain and swelling and altered input ultimately that happens right away into the knee. And when you have swelling and pain, it's going to compress the nerves. So you're not going to get as great of signaling from that muscle to the brain. So your signaling kind of even slows down. So typically the quad is very much related because it attaches right to the knee. So that signaling is already starting to slow down, which means that you're going to get less and less contraction of that muscle unless you force it to work. And so what happens is that motor unit actually gets inhibited. So it gets cut off. The body is smart. What it wants to do is not be in pain. So if it feels that it's going to be in pain, it's going to shut off a muscle. It's its own defense mechanism in order for us to not be in pain, which is great, but then we lose all this muscle because we're not getting any signal to it. So you have to force it to contract to actually start to send signals to the brain and to the muscle to keep that pathway going. So this also alters your proprioception in your feedback. If you're not getting signals from your muscle to your brain, then you're altering, feeling where you are in space. Your knee probably feels really unstable and wobbly, and that's because you're not getting those signals from that muscle to your brain to tell you where you are in space to stabilize you. And then as a result, you get muscle atrophy, which is loss of muscle weakness, and then you're probably compensating a whole lot because that muscle's not doing its job. So then you start to use your hip or your lower back or your ankle, and all these other things start to hurt because your quad's not doing its job. And then that turns into psychological factors where, you're starting to learn not to use the muscle, and then you're having fear of using that muscle because of potential pain. Then you're not able to do the things that you want to do, and that leads to some depression. Like, psychology is also involved in injury, guys. It does play a really big role. So that's kind of the cycle that happens immediately after injury and immediately after surgery. So how do we fix that? One, if you have an injury, it's super important, yes, to take away the painful stimulus originally, but then you have to start using your muscles, maybe in isolation with isometric holds or specific exercises that are going to make that muscle have to do its job and have to work so that that pathway continues, or we reset that pathway so that we don't end up with a whole lot of muscle loss. So in the beginning, we're going to do specific exercises for the quad that are going to start to ramp it back up. So we disinhibit that motor unit. We're going to start it back up. Then that's going to help with your proprioception and you being able to tell where you are in space and have more stability in that knee and just muscle activity in general, which is then going to help you grow more muscle and then ultimately fully recover, which is always the goal, right? Now, the quad is actually made up of 4 different muscles. That's why it's called a quad, quadriceps. Right? A lot of people are like, oh, quad, okay, got it. Didn't realize that. Which, if you didn't go to PT school or didn't learn anatomy, you wouldn't know that, right? So let me show you those 4 different quadrants there. Now, let me just move myself and make myself a little bit bigger. So, this ended up being a super small. Okay, we can zoom it in. So, your quad muscle, quadriceps 4, is made up of 4 different muscles. You have your rectus femoris, which is the biggest one that's in the middle. That's what a lot of people would feel or think of. That comes from your hip. They all come from your pelvis up at the top of your hip. Then you have your vastus lateralis, lateral, on the outside of the knee. And vastus medialis, which you've probably heard of the VMO, which is this muscle right here, which gets a lot of hype. People talk about the VMO and strengthening the VMO a lot with knee pain. It's super important, but so are all the rest of these fibers of the muscle. I think it gets overhyped a lot of the time. You can lose a lot of muscle in that VMO, but ultimately we need to gain strength in this entire muscle group and not just focus on one. And then lastly, a lot of people don't even know this exists, but the vastus intermedius, and that is actually sitting underneath the rectus femoris, that big one. So you don't see it here in the picture, but it sits underneath it. Now, if we only did leg extensions or things straightforward and didn't really isolate either side of the quad, specifically the lateral or the medial side, we'd be missing some of those fibers. And that's why I do specific exercises with those 3 angles, and it made a huge difference with my knee rehab. I will say in this video too, because it is a hot topic, knee extensions are not bad for your knee. They're one of the best ways that you can build your quad. A lot of people will talk about how it's super not functional. When are you ever kicking your leg up like that? I would say you are in certain sports, right? Certain activities, but it's a way that we can isolate the muscle. Because ultimately we want to be able to isolate muscle, especially when recovering from an injury. So everything doesn't need to be super functional. It has to have a purpose, that's for sure. But you're not putting your knee in danger at all. it's only in danger if you're doing a load that it's unprepared for. So we have to start light a lot of the time. But it's not a dangerous movement. There is no inherently dangerous movement for the body. It's only dangerous when you're unprepared for the load, the movement, the range of motion, or the frequency of it. Okay, so I want to make sure I put that in there because a lot of people will be like, oh, I was told not to do knee extensions because they're bad for your knees. No, that's not true, guys. Knee extensions were one of the best things that I could do to strengthen my quad, especially after knee surgery when I had lost so much of my quad. So that will be in this program, just a heads up.